Greetings, my friends. This is Dr. Jaime Daniel, and today I want to share with you an overview of Paget's disease of bone. It is a chronic disease that causes bones to grow larger and become weaker than normal. The disease usually affects just one or a few bones. The bones most commonly affected by Paget's disease includes pelvis, skull, spine, femur, and tibia. Many people with Paget's disease do not experience symptoms specific to the disease. However, the bone changes can cause bone pain, misshapen bones, broken bones, inflammation, and arthritis in the joints close to the affected bones. With treatment, many people can manage their symptoms, improve pain, and control the effects of the disease. Throughout your lifetime, the body constantly removes old bone and adds new bone to the skeleton. As we age, it is normal for this process to happen at a slower pace. As the disease starts, the body loses much more bone than it makes. As Paget's disease progresses, new bone forms at a faster rate than the rate at which old bone is removed. However, the new bone does not form correctly, leading to larger bones that are misshapen, weaker, and softer than the normal bone. Certain factors may increase your risk for Paget's disease. For example, the age. Paget's disease is uncommon in people under age 40, and the chance of developing the disease increases as you age. Anglo-Saxon descendant. Paget's disease is more common in certain geographical areas, including North America, Australia, New Zealand, and Europe in people of Anglo-Saxon descent. It is not common in Asia, Africa, and Scandinavia. Your family history. Paget disease commonly occurs in families. Studies show that men may be slightly more likely than women to have the disease. You may not know you have Paget's disease because many people with the disease do not have symptoms. However, fractures or misshapen bones can develop and cause pain. Sometimes, this bone pain, which is the most common symptom of the disease, is mistaken for arthritis or other disorder. Generally, symptoms develop slowly, and the disease does not spread to normal bones. Paget's disease can affect any bone, but usually occurs in spine, pelvis, femur, and tibia, and skull. In addition, some people with advanced disease may have misshapen bones and other bone changes, which may include increase in head size, bow shape of a limb, curvature of the spine. Other symptoms can develop depending on the bone affected and can include headaches or hearing loss when Paget's disease affects the skull, tingling and numbness in arms and legs when enlarged vertebrae put pressure on the nerves in the spine, hip pain, which may occur when Paget's disease affects the pelvis or thigh bone. Depending on the bone or bones affected by Paget's diseases, other medical problems can develop, such as damage to joint cartilage can lead to arthritis, changes in the bones of the skull and ear can lead to hearing loss. For some people who have heart disease already and severe Paget disease, the extra workload of pumping blood through the body can lead to heart failures. Enlarged bones in the skull and spine can lead to pressure on the brain, spinal cord, or nerves and reduced blood flow to the brain and spinal cord. When Paget's disease affects the facial bones, the teeth may loosen. This may make chewing more difficult. Rarely, people with Paget's disease can develop bone cancer. Researchers do not know the cause of Paget's disease. However, they suspect that environmental factors and genes play a role in the development of the disease. Scientists have identified changes in genes that may increase the chance someone could develop Paget's disease. In addition, researchers are studying how certain viruses also may cause the disease in people who already have risk factors for Paget's disease. Some studies suggest that in some countries the number of people who have Paget's disease and the severity of the disease are decreasing. If you do not have symptoms, you may not need treatment. However, if your disease is active, you have symptoms, or you have a higher chance of developing complications, your doctor may recommend treatment. The goal of your treatment is to slow down or stop bone breakdown and formation, lower the risk of complications, ease the bones and joint pain, repair fractures, correct bone deformity. The doctors can recommend several options to help treat Paget's disease, prevent complications of the disease, and promote bone health, including medication, surgery, exercise, diet. Treatment can help you manage your symptoms but does not cure the disease. Fortunately, current treatments can help most people with Paget's disease lead a productive life. When you follow your doctor's treatment plan, you may lower the chance of developing complications or major changes in your bones. You should also maintain a healthy weight, which is particularly important if Paget's disease has led to arthritis of the weight-bearing joints, such as the hip or knee. Excess weight can mean more stress and pain for affected joints. Prevent falls by checking your home for dangers such as loose rocks and poor lighting, installing grab bars and handrails, using non-skid mats in the bathroom and tub, having regular eye exam, increasing your balance and strength by exercising every day. Live a healthy lifestyle to maintain good bone health. Do not smoke, and if you do smoke, quit. If you choose to drink alcohol, do so in moderation. It is best to have no more than one drink a day for women and no more than 2 drinks a day for men. Well, I hope you enjoyed this episode, and we will see in the next one. Thank you.